It had been 70 years since Mary Law 24 realized she has an abnormal opening in her genital tract and urinary tract. Since then, Mary said she had been suffering from constant social segregation, shame, and health problems up to the extent she was divorced.
Kalande o bata o hindu kam sabasana alela ayanta ile akin yomda gana girwa piwa na dictor pe simto said na girwa na o kedu matim ma kedu kos era yomda gana gija pi Juba ile masai papa bir Juba di dande Editora di monjai zaman yida de na gija o awu kedu o matin na gija lela ajil tayo subana kalam bunde aturu jana gala na mader marafin kira ana bi joji marata na di na gal kwes ana fodul baro abu tay mutu matai o masi segato o sino rajin tano ana mai matai ni na gana sponsor alana talaka beje matai maki.
It is estimated that more than 2 million young women like Mary live with untreated fistula in Asia and sub-Saharan Africa. But on Saturday, the Reconciliation Lutheran Church Primary Health Care Center, in partnership with Star Pharmaceutical, launched a week-long free fistula operation as a response to the physical and mental suffering of women in South Sudan, including Mary and 34 other women. Senior fistula surgeon Dr. Andrew Brown said the development of obstetric fistula is directly linked to one of the major causes of maternal mortality, obstructed labor.
All the fistulas just from obstructed labor. So if a woman gets stuck in labor and can't get to a hospital, then she's at risk of getting fistula. So the fistula patients we've treated have been in labor for 3 or 5 or 7 days. They deliver a dead baby and they start leaking urine. This lady was a bit different. She was born with a fistula, which is very, very rare. I've only seen 1 or 2 patients like this in my whole life. She had a difficult operation, but we hope that she can be cured today.
The Undersecretary in the Ministry of Health, Dr. Mayen Achek, said the ministry is working to improve antenatal care for pregnant women. Dr. Mayen also advised parents not to marry off their girls at an early age.
As Ministry of Health, we have established a National Fistula Center at Juba Teaching Hospital, from where all the operations start, and teams are dispatched to all over the country. And unfortunately, because of lack of funds, this work is done through partners and is now pioneered by our own community groups like the Lutheran Church. And that's why the Ministry of Health is working very hard to increase the number of midwives and the number of obstetricians. And once we increase these numbers, we will be able to really conduct antenatal care services all over the country in our 80 counties. If we do this in our 80 countries, we'll be able to pick up those women at risk of having fistula during childbirth, and therefore we could reduce the problem to nothing.
According to World Health Organization fact files, each year between 50,000 and 100,000 women worldwide are affected by obstetric fistula. Preventing and maintaining obstetric fistula contribute to the Sustainable Development Goal 3. Fistula can be prevented. It can be prevented by delaying the age of first pregnancy and access to fistula care. For SSBC News, I'm Emmanuel Patrick, Lutheran Church Primary Health Care Center, Juba, Central Equatoria.